Yes, ma. Yes, ma. Yeah, we can see your. Yeah, we can see your screen. That's fine.
Okay, thank you so much
Yeah.
for
I,
waiting. I think we're right on
no.
time now.
Yeah, yeah. We would like to stop the screen share right now. We'll begin by giving an introduction and all, and then when we invite you, Dr. Astha, you can start sharing whenever you feel it. Yeah.
Letting people in now.
Yes, yes. Hi, Rashmi.
Hi. Hello. Hello, Dr. Astha.
That's
Hello,
Rashmi
hello,
Joshi,
hello, ma'am.
doctor.
How are you?
I'm good. Hi, Parul, Brinda.
हेलो रश्मि मैम, कैसी हैं आप?
बिल्कुल ठीक.
नाइस.
So we will be having an international audience today. We have some confirmation from Brinda will be able to tell us that whenever we have.
I'll just come.
Ma, I would like to mention over here, Dr. Astha agreed to be here with us at such a short notice.
Yeah,
She was actually on a holiday when we contacted her, and she readily agreed.
Well, that is so apparent from the young and beautiful that they're so enthusiastic and want to give us their time. Thank you so much, Astha, just for your time.
Most welcome. I really like this opportunity, so I thought I should,
Thank you so much.
Join this initiative.
I'll be sharing the link with you, Dr. Astha. We are live on our YouTube channel right now.
Okay, all right.
I think we can start then. It's 5:03.
Yeah.
I think Smita ma'am has also joined us.
Yes, so happy to see you.
बृंदा जी, स्टार्ट करें हम? थैंक यू. दोस्तों नमस्ते, मैं पारुल आपका सबका स्वागत करती हूँ हमारे आज के डाउन सिंड्रोम फेडरेशन ऑफ इंडिया के सेशन में, जो शनिवार का हमारा सेशन होता है. आज हम एक बहुत ही खास से टॉपिक पर बात करने वाले हैं, जो हमारी हमेशा हमारे बच्चों को लेकर एक केयर की प्रॉब्लम वाली बात हो जाती है. बहुत सारी ऐसी हेल्थ के इश्यूज हैं जो हमारे बच्चे फेस करते हैं और जिनके लिए हम अलग अलग स्पेशलिस्ट से आपको मिलवाते ही रहते हैं. आज ऐसी एक खास स्पेशलिस्ट हमारे साथ हैं, डॉक्टर आस्था शर्मा, जो हमें बताएंगी कि डाउन सिंड्रोम ब्लेस्ड बच्चों और एडल्ट्स में स्किन की प्रॉब्लम्स क्यों होती हैं. क्या ये कोई इन्फेक्शन है, क्या ये न्यूट्रिशन में कोई कमी है, या फिर ये बाहर से आने वाला इन्फेक्शन है. इन सब बारों में बात होंगी हमारी आज इस पर, और उसके हमें समाधान भी वो बताएंगी. तो उनसे मिलने के लिए सबसे पहले हम जाएंगे हमारी दोस्त समीक्षा के पास. बहुत ही खूबसूरत हरे रंग के कपड़ों में हमें बहुत ही खूबसूरत सी मेरी दोस्त दिखाई दे रही है, जिन्हें देखते ही मेरे चेहरे पर रौनक आ जाती है. साथ में डॉक्टर रेखा रामचंद्रन हमारे साथ है, डाउन सिंड्रोम फेडरेशन ऑफ इंडिया की प्रेसिडेंट. मैम आपका स्वागत है. मेरी दोस्त बृंदा जी हैं हमारे साथ में, जिन्होंने ये प्रोग्राम स्टार्ट किया है. और आप सबने कलकत्ता के लिए अपने जो है पूरा अपना क्या कहते हैं उसको रजिस्ट्रेशन आपने करा लिए होंगे. इस उम्मीद के साथ हमारा आज का सेशन हम शुरू करते हैं. समीक्षा.
Yes, we truly hope that you all have registered for Kolkata. I think we are almost full there, and the conference is going to be full strength. We are very happy. So thank you, Parul, and good evening, everyone, and welcome in today's session. Yes, this special session is in connection with and a continuation of the joint efforts of Down Syndrome Federation of India's Delhi chapter, Down Syndrome Parent Society, and IAP West Delhi. We are so grateful to Dr. Dinesh Goyal, President, and Dr. Smita Mishra, President-elect of IAP West Delhi, for connecting us with renowned medical practitioners of different specialties in the Delhi NCR region. And today we are going to talk about dermatological conditions one can encounter in life, and specifically those that are associated with the diagnosis of Down syndrome. Our expert for today is Dr. Astha Sharma. Following her medical degree She underwent extensive clinical training to acquire the necessary abilities for diagnosing and treating various disorders affecting the human skin, hair, and nails, and other cosmetic problems. She's an MD and visits many big hospitals, both private and government, as a dermatologist, cosmetologist, and dermatosurgeon. She's a passionate caregiver, and in a very short notice, she's able to give us this session for 1 hour and has healed so many patients who were seeking a cure for her expertise for their dermatological problems. She has contributed to several offline and online workshops, seminar, conferences, and webinars over her more than a decade of clinical practice. She has received numerous honors and awards also, and also published in both domestic and foreign journals her papers and researches. So, Humsafar family, with a deep gratitude for IB West Delhi, please join me, Parul, Rekhama, Brinda, and Federation in welcoming one of the renowned doctor, Dr. Astha Sharma. A very warm welcome to you and a heartfelt welcome to you, doctor. We are all waiting to get enriched with your experience and knowledge. Over to you now. We'll be very fortunate if Dr. Smita and Dr. Dinesh joins us. Yeah, over to you, Dr. Astha.
Thank you, Mrs. Samisha and Mrs. Parul, for the lovely introduction. It's my pleasure to be part of this session today. It's a great initiative by DSFI. And special thanks to Mrs. Rashmi for inviting me today. And my regards to Mrs. Surekha. I got to learn about her through DSFI only, and she has been inspiring and touching lives of so many families and children. So it's my honor to be here. And I also welcome the parents and children who are part of today's meeting. So I'll walk you through the presentation. I've made a short presentation on the common skin conditions that we see in children with Down syndrome. I'll quickly go through it, and then, any queries, anything that we can discuss further. I'll be sharing the screen. Is my screen visible?
Yes.
Yes, okay. So I'll quickly start with this presentation. So I'll start with some common physiological skin changes that we see in these children. Firstly, they have dry skin, very dry skin, xerosis that we call it in our medical language. They have a dry, flaky skin, which is more prone to itching and irritation. They also have, you can see thick skin of the palms and soles, which is called keratoderma. So for dry skin, this can be managed at home by using very gentle moisturizing soaps, by using fragrance-free moisturizers. Sorry. So, and avoid using hot water. Even during winters, you should be using lukewarm water for the kids because their skin tends to get very dry with hot water. We see a lot of changes in this, in the mouth, lips, tongue. You can observe they have large tongue, fissure tongue, and some cracks can be seen on the corner of the lips. That is sometimes due to vitamin deficiency, sometimes because, a bit of drooling of saliva. Could be due to fungal infection, candidiasis. Sometimes yeast infections occurs on the corner of lips. That can lead to angular cheilitis. This again is a very common condition, atopic dermatitis. One can observe reddish, itchy patches on the skin, especially on the skin folds, like in the inner surface of the elbows, knees, behind the knees, necks. These are common areas where the skin gets red and very itchy. Sometimes because of itching and scratching, bacterial viral infections enter the skin. So what we should remember again is to moisturize the skin. Ceramide-based moisturizers should be used. If required, we need to use topical steroids also, but that should always be done, under the care of a dermatologist. And any triggers like dust, change of season, some woolen clothes, fungal spores, pollens, any pets you have, these triggering factors you should know. What are these conditions that are triggering your child's eczema? So that should be taken care of. Kids are very prone to infections, especially fungal infections because of excess sweating. It can lead to different kind of fungal infections of the scalp, which is tenocarpitis. Then we have annular itchy rashes on the body, which is called tinea corporis. This picture that you can see is actually tinea corporis. These are fungal infections of the body. Because of the sweating between the toes, there can be infection on the foot, which is called tinea pedis. Then candidiasis, which is a yeast infection, just similar to fungal tinea, but a different variant. That also basically has you can see a red rash and whitish small pustules, kind of satellite lesions that you can see. So those are basically candidial infections. So if you observe such conditions in your child, if any such lesions you see, quickly you should show to a dermatologist before it actually flares up. Because smaller lesions can actually be treated with the topical medication, some antifungal soaps. But when it progresses a lot, then we have to add oral antifungals. So early diagnosis is the key here. Seborrheic dermatitis, sort of, we can consider this as a severe variant of dandruff. You can see itchy flakes on the scalp, in the face area, beard area, around the eyebrows, around the nose. That is very troubling sometimes for the kids. On a newborn and infants, when they're born, they can see greasy yellowish scales on the scalp, that is cradle cap, which is similar to seborrheic dermatitis only. So they can be managed with antifungal shampoos or mild steroid-based shampoos, which can subside the inflammation. If it aggravates, again, you have to see us, you have to meet us. We can, simple topical medication can treat this. Again, a very common condition. Actually, we also experience this thing. You might have noticed some reddish bumps on the extensor outer surface on your arms, thighs, legs. These are basically keratin plugs around the hair follicles. So, but sometimes they can get very inflamed and very red and itchy. Then then you need to treat it. Otherwise, simple moisturizers which contain urea lactic acid can settle this kind of condition. Kids are very prone to acne, and especially the teenagers after the age around 13, they start to develop acne. Bacterial infections can occur around the hair follicle, leading to folliculitis, boils, bacterial infections that you need to treat. Mostly can be treated with topical medicines. Yes, if it flares, then oral antibiotics and oral medicines have to be added. So the children should be taught to wash their face twice a day. That is very important. Washing the face twice a day. If the skin is getting oily, then a very light gel-based moisturizer can be used. Clindamycin gel, they're the most commonly used gels for the acne, that can be used. And for oral medication, definitely, if there's an acne flare, then we can add some mild acne medication for your child. The kids should be, explained that they should not try to, scratch their acne. They should not scratch and rub their boils, because then it can get further infected. And that is extremely important, especially during this season, this rainy season. A lot of mosquito bites are happening, and I see, children coming and scratching their bites, and they get infected. So that also they should be counseled about. One condition I've not mentioned here is hidradenitis suppurativa. In this, there are a lot of boils and infections which are happening in the underarms area, in the groin area. So if your child is suffering from that and having big boils, which is leaving scarring in the underarm area, groin area, then probably it is just not simple folliculitis or simple furuncle or boil that we say. It probably could be another condition called hidradenitis suppurativa. So that needs a separate treatment. So you should be careful about that. You should observe that, and if you see such lesions in the underarms area or in the groin area, you should definitely visit your dermatologist. Syringomas, might have noticed some very small skin colored, very fleshy papules lesions, raised lesions around the eyes. They are very benign. They're mainly of cosmetic concern only, nothing to worry about. They're more commonly seen in Down syndrome, and mainly mostly the girls are affected with this, and especially in the adolescent age group, this eruption occurs. Nothing has to be really done for this. That's mostly a cosmetic thing. A lot of other skin changes, pigmentary changes, like the occurrence of moles is more common. Freckling, there's another pigmentation called cafe au lait macules. Cafe au lait macules usually are present at birth. Again, nothing to be worried about. You might have more occurrence of these conditions, but these are perfectly benign and nothing to worry about. One pigmentary change, again, here you might have noticed there's something called acanthosis nigricans. There's thickening, velvety thickening of the skin around the skin folds, like the neck, around your knuckles, underarms, in the inner surface of the elbow. The skin tends to get a little thickened and dark. That is acanthosis nigricans. It basically occurs sometimes because of obesity or insulin resistance, or if your child is diabetic, then it can happen. So then a bit of premature aging can happen. The skin gets wrinkled and thin earlier than the other children. The wound healing is also a little delayed because of the reduction in collagen and reduced blood supply. The wound healing is also a little delayed. So these are normal physiological changes that you see in the skin. Another one condition you might have seen in the child is alopecia areata, where suddenly round bald patches they develop on your scalp. So it is an autoimmune condition. Autoimmune means your body itself is trying to fight your hair. It is producing antibodies against your own body parts only. So suddenly, at one point, at one patch, the hair just overnight it just goes away. So it can happen anywhere in the body, on the scalp, on your eyebrows, or in the body. And again, it's more of a cosmetic problem. It's nothing to be like worried about. It is not affecting you internally at all, and it can be treated. Smaller patches can be easily treated with topical medications. And if required, if it is progressing to the body or anywhere else, then some oral medicines are added, which can stop the progression also. So again, very safely, this can be treated. Vitiligo, yes, this is a very difficult condition. The body starts to lose the pigment at places, and again, it's a cosmetic problem. I am saying this again and again because I want to define that the child should not be really, should not feel any kind of complex with such things, be it any child, I feel, be it us or anyone. It's just a cosmetic problem. You're just losing your color. It's not disfiguring you in any way. So this also can be controlled, can be stabilized to some extent. We can produce the pigment back also. The only issue is these skin colors, these these white patches are more prone to sunburn. So we should tell the child, to wear a sunscreen or to avoid, making the child go during the extreme hot hours. So in most conditions, early treatment is the key. Just when the infection sets in or any kind of condition that you observe, if initially we treat, it is easily managed mostly by topical medications. So that is really important. Some skin changes also occur because of vitamin deficiencies. They're more prone to vitamin deficiencies like iron deficiency, B12 deficiency, vitamin D deficiency. So sometimes, some pigmentary changes, nail changes, dental changes can occur because of multiple vitamin deficiencies. For that, you can always, visit your pediatrician or your dermatologist. And yeah, that's it. That was my small presentation. And I would love to discuss further with you any particular condition that you want to discuss or any problem that your child is facing that we can discuss now.
Thank you so much, Dr. Astha, for keeping a track of time. This is one thing we really struggle in many of our sessions, that while going through, the presentation or discussion, we just overshot. And for the interest of everybody, I want to share that she's sparing this hour during her OPT times. So if you have questions, please raise your hand. We will quickly go on to it. Rekha Ma, we will start from you. You want to add something?
Astha, I think it was a very comprehensive, very, very clear presentation. And I think all of us don't have any questions after this. So all of us need to walk around with a dermatologist in our pocket. The important thing is that there is a fear. Everything is a fear more than anything else, especially because, like you said, it's a cosmetology issue. But
Yes.
anything cosmetic is always frightening. So they go into a tizzy. Like today, I think all of us will know that there was a child who had a little bit of yellow on the arms, and there was panic. So, I think it's so important for us to be able to be avail of your knowledge, which is what I would like, because you can have every other doctor on our board, but we have run out of ideas of how to bring in a cosmetologist or skin specialist, because the reason is this is one of the largest organs. And you know that it starts from the hair. I mean, many of our children have alopecia, and when they lose hair, the parent loses hope. So how much ever I have built it up, when it comes to, it looks like I'm losing it. The child doesn't look, I can't take it out. I can't, because skin and appearance is very crucial. It's very crucial in any society. And I have seen, like you said, pigmentation, all of these issues we have seen with our children. But we cannot recommend, with dry skin is so common, you know that. But it needs a person of your expertise to even tell them, at this point, the weather is like this, so you use this. So are you, can you give your services to us? We are always the type of people who like to tell people, join us, please. We need you on our board. And I can see Rashmi smiling all over her face, but we don't have a dermatologist. And any dermatologist is so packed. I think they have more patients than anybody else in the universe. So, and I need to remove this fear that parents have, because, near the mouth, they have patches, then they have fisher tongue, they have alopecia, you know that. And as they're growing older, everything becomes an issue. So added to that, we're already dealing with a lot of issues. Skin becomes my major, major issue. And how do we comfort them by saying it's going to become okay? Sometimes it's very difficult. So we are not going to leave you alone, because you're young and right there at the right time. and we were going to use your services. Girls,
Absolutely,
go for it.
absolutely. Anytime at your service.
Yes, ma'am. So we have few hands raising and a question in the chat box.
Thank you
So
so much. Your presentation really zapped me. I haven't moved from this place. Honestly, it was the best presentation in the sense it was so precise. These are the issues we are seeing every day. And thank you so much.
Oh my
Thank you.
God, thank you so much. Thank you so much for such kind words. I'm actually overwhelmed. I actually was short on time, so I tried to make it as small
Oh,
and
that's perfect.
crisp as
That's perfect.
possible.
Yeah.
It covered everything.
So-
Yes.
Yeah.
Sammy, go ahead.
So yes, ma'am. So quickly, if you want to share that, what should we do about extreme flakes and dandruff if we experience with our children? Then we go to Priyanka for question. This is in the chat box. A parent wants to know extreme flakes and dandruff.
Okay, so basically,
Hello.
there are very mild steroid applications are available in the market, like Candid B lotion. That's one of the mildest lotions that you can begin with. That can start applying on a daily basis for maybe a week or two. That should subside the inflammation. And you can use ketoconazole based shampoos, ketoconazole and ZPTO based shampoos. If it still does not resolve, then you have to visit a dermatologist for some stronger medication. Otherwise, you can write it down somewhere. Candid B lotion.
Yeah.
So that is one of the very
Yeah, Dharini, I
simple
hope you
medication
have
that you can
written.
use for your
Yeah.
mild dandruff.
Astha, that shampoo you suggested is what I use for my daughter.
Yeah.
But it's a little on the expensive side. Am I right?
No. Ketoconazole, ZPTO shampoos, they will range somewhere about 300, 400.
300, 400 is
rupees?
expensive.
No, but if you go for all these hi-fi sulfate-free shampoos, they actually
So,
range
so
700,
girls,
800.
please note down all these things so that
Yeah.
we can support our people. If they
Yeah.
can't afford it, we will suggest that we send it to them. Okay? Please make
Yeah.
a note of all these things because
Yes.
see, all these issues we don't have to keep running back to Astha once
Yes,
we
ma'am.
have it on record.
Yes.
Okay,
Yeah.
Parul?
Yeah.
So that it's very important. And I know it works wonders.
Yes.
Yeah.
So Priyanka, you can unmute yourself now and ask.
Hello, ma'am.
Hello.
हेलो मैम।
Yes,
मैम,
Priyanka.
मेरा बेटा अभी 6 साल का है और वो जब 1 साल था तो जैसे आपने पिगमेंटेशन होता उसका जो पेट का एरिया है और चेस्ट का एरिया तो उसको जगह जगह ही पिगमेंटेशन के पैचेस हो गए सर्कुलर उसमें शेप में और वो बढ़ भी नहीं रहे हैं मतलब उसके साइज जैसे जैसे बच्चे का एज बड़ी होती है तो साइज बढ़ता है उसके अकॉर्डिंग बढ़ रहा है लेकिन उस एरिया पर है तो वो पिगमेंटेशन वाली ही प्रॉब्लम है।
अच्छा, राउंड पिगमेंटेशन बन रहा है उनके। कितना
हाँ,
टाइम हो चुका
चेस्ट
उस
और
चीज को?
tummy। वो जब 1 साल का था वो तभी हमें दिखा था पहली बार।
1 साल, अभी 6 साल का,
अभी
तो 5 साल हो गए हैं।
साल जी 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 जी
इसके लिए वैसे अगर आप किसी को एक बार फिजिकली अपने पीडियाट्रिशियन या एक बार स्किन स्पेशलिस्ट को दिखाएंगे तो बेटर होगा कि कोई फंगल इन्फेक्शन का पैच है कि कोई पिगमेंटेशन के ही पैच हैं। अगर पिगमेंटेशन का पैच है तो हमें ज्यादा सोचने की जरूरत है नहीं। बट अगर फंगल इन्फेक्शन है तो डेफिनेटली हमें उसे ट्रीट करना चाहिए। तो बिना देखे अभी बोलना मुश्किल होगा कि वो एग्जैक्ट किस चीज का पैच है।
Okay.
मैंने उसको यहाँ तो डॉक्टर्स को दिखाया था तो आप जो बता रहे हो ना कीटोजोनाजोल कुछ कर वही वाला उन्होंने दिया था लगाने को लेकिन उससे कम भी नहीं हो रहा लेकिन बढ़ भी नहीं रहा है।
अच्छा। आपने स्किन स्पेशलिस्ट को दिखाया था या पीडियाट्रिशियन को?
ऐसे ही जो पीडियाट्रिशियन होता है उनको।
आप किसी स्किन स्पेशलिस्ट को दिखाइए बिकॉज कई बार पीडियाट्रिशियन के लिए भी मुश्किल होता है कह पाना कि पिगमेंटेशन है, फंगल है। क्योंकि अगर फंगल इन्फेक्शन है तो वैसे कीटोकोनाजोल शैम्पूज या फिर कोई एंटी फंगल क्रीम से आराम पड़ जाना चाहिए। मे बी वो कुछ पिगमेंटेशन के ही पैचेस होंगे जिनमें आराम नहीं आया है अभी तक।
तो मैं यहाँ डर्मेटोलॉजिस्ट को उसको
हाँ।
दिखा दूँ एक बार।
हाँ
हाँ जी।
हाँ Okay, Priyanka. Thank you, Priyanka. We request Millie to unmute and ask, please.
गुड इवनिंग मैम।
गुड इवनिंग।
मैम कुछ दिनों पहले मैम मेरे बेटे का वो अंडर द फीट वो कॉर्न जैसे हो जाते हैं ना वो हो गए ठीक है।
अच्छा।
और पहले तो एक था, 1 से 2, 2 से 3 ऐसे। तो 1 ईयर बैक मैंने वो दिखाया था, मणिपाल में ही दिखाया था। एंड दे सजेस्टेड सेलेक्टेड पेंट।
ओके।
तो सेलेक्टेड पेंट में मैम वो जो ऊपर का रफ जो एरिया है वो तो निकल के आ गया, बट पूरी तरह से वो ठीक नहीं हुआ। ही इज स्टिल हैविंग पेन, एंड वो एक आध बार इधर उधर से मतलब वो दिख भी रहा है, फिर बढ़ रहा है वो। उसका कोई
अच्छा, देखो आप जो बोल रहे हो वो वॉट होगा, वो कौन नहीं होगा। वॉट एक एचपीवी वायरस का इन्फेक्शन होता है, वो किसी को भी हो सकता है। वो मैं हूँ, आप हो, बच्चा है, किसी को भी हो सकता है। इट्स अ कॉमन थिंग।
ओके
इट्स नॉट स्पेसिफिक टू चिल्ड्रन विद डाउन सिंड्रोम। तो वो
ओके
वायरस उसको लग गया है, इन्फेक्शन उसे लग गया है। सेलेक्टिन से अगर आराम नहीं आ रहा है तो एक दो और चीजें होती जो हम ट्राई कर सकते हैं उसको कम करने की या हटाने की। अल्टीमेटली अगर किसी चीज से आराम नहीं आता है तो फिर उसको माइनर एक सर्जरी करके उनको हटाया जाता है।
अच्छा
अगर आपने मणिपाल में ही दिखाया है तो आप आके मुझे ही दिखा दीजिए। मैं अगर आप यहीं दिल्ली से हैं तो मैं भी मणिपाल में अवेलेबल हूँ। एक बार आके आप मुझे दिखा दीजिए अभी क्या करंट कंडीशन है, हम उसमें हम और क्या फर्दर ट्राई कर सकते हैं वो हमें पता चल जाएगा।
मैम, आप रोज अवेलेबल होते हो?
नहीं, मैं ट्यूसडे थर्सडे सैटरडे को अवेलेबल होती हूँ सुबह 11:30 से 2 बजे तक।
ठीक है मैम, मैं आपको कांटेक्ट करती हूँ फिर।
जी।
ओके, थैंक यू मैम।
ओके, थैंक यू।
Sammy, unmute yourself.
चैट
Sorry.
बॉक्स में भी शायद कुछ क्वेश्चंस
Yeah,
थे,
yeah.
अगर आप
I was taking the question from the chat box that what should be done for the black hyperpigmentation of underarms and neck. So you also mentioned it during your talk. Yeah, please,
हाँ
ma'am.
हाँ, मोस्ट प्रॉब्ली अकैंथोसिस नाइग्रिकन्स होगा जहाँ स्किन थिकनिंग हो रही है। सो फॉर दैट यू कैन यूज सम ग्लाइकोलिक एसिड एंड लैक्टिक एसिड बेस्ड क्रीम्स। एंड टू बिगिन विद एक जेरीना करके क्रीम आती है, जेरीना। तो यू कैन स्टार्ट विद दैट। एंड देर आर ऑल्सो सम स्ट्रॉन्गर मेडिसिन, बट देन वो बच्चे का कितना पिगमेंटेशन है, कितना स्किन थिकनिंग है, वो देख के ही हमें सजेस्ट करनी चाहिए। बिकॉज सेंसिटिव स्किन भी होती है बच्चों की, कई बार एटोपिक्स भी होते हैं, ड्राई भी होते हैं वो। तो उनके हिसाब से ही हमें ट्रीटमेंट प्लान करना चाहिए। बट एक जरीना करके क्रीम है वो शुरू कर सकते हैं फॉर दैट स्किन थिकनेस, कैन गिव सम इम्प्रूवमेंट।
Yeah. Parents, please keep writing down the prescription given by the doctor if you can.
Zarina is X.
XERINA।
Yeah.
या कॉमनली
Yeah.
अवेलेबल, मैं आपको कॉमन वो ही बता रही हूँ जो
Yes.
यूजली हर जगह मिल जाएंगे ऑल ओवर
Which
इंडिया।
can, and for any specific more detailed treatment, you have to visit a dermatologist in person. That's ma'am is suggesting. So parent wants to know the good moisturizer or oil for excessive dry skin. It's an adult son of 21 years old.
ओके। ड्राई स्किन में यूजुअली जो ओट मील एंड सेरामाइड बेस्ड मॉइस्चराइजर्स दे आर गुड। एक रीजनेबल मॉइस्चराइजर दैट आई वुड सजेस्ट इज Aquasoft Max lotion comes, that's from Ajanta.
Okay.
That is ceramide based.
Okay.
So that can be tried. Aquasoft Max lotion.
Yeah.
One is Venusia Max lotion, which is from Reddy's. That's also a reasonably paced lotion. But usually Sebum and Cetaphil, they are on the expensive side. So you can go for these moisturizers and regularly moisturizing 2 to 3 times a day. You should do that, and also try to use moisturizing soaps. Dove like is a very good moisturizing soap. You can go for Dove.
So I think that's for everybody who's asking for dry skin and moisturizing.
Loose
So,
cotton wear,
yeah.
try to make your child wear loose cotton clothes, especially during the season.
Yeah.
It's very, very humid.
Yeah. So thank you, doctor. Next question says that what should we apply on a boil if it is in a groin area?
Okay, a small, if it is a very small boil like a folliculitis, that can be treated with the topical antibiotics. एक tea-backed cream आती है, tea-backed, BACT cream. It's mupirocin-based cream, so that can be applied twice a day. You should keep it with you wherever you feel ki some kind of a, pus-filled lesion or boil is developing. You can start applying it. Still, if it does not resolve, then you should see a doctor. Probably he or she might need some oral antibiotics.
Okay.
And if it is recurring again and again in the groin, if it is leaving a scar, again you should meet your doctor.
Yes.
I'd like to tell you one thing here, Astha. Most often we have noticed that the groin area is the one area we see the boils. Okay. So these type of things are very painful because it remains moist.
Yes, exactly.
And the other thing is, because of the temperature in our country, the other important thing is that, I don't know whether we should advise them to remove hair, because sometimes the hair follicle, I believe, was what irritated my daughter. And she, like, when you are wearing pads and you tend to wear the panties on top of it, sometimes it's very wet, so you tend to pull one hair follicle, which can cause that severe pain in that boy. Okay, so we started removing hair wherever, underarms or in the groin area. And it definitely comforted her, because that hair must have been an irritant. Is it advisable for most parents? Because I want you as a doctor to tell them that this is advisable or not.
So actually, waxing and shaving can actually even aggravate the problem of folliculitis, because you're actually irritating the hair follicle again and again by removing it. And sometimes when these hair grow back, they start to ingrow into the skin and further aggravating the problem. So I would suggest, for maintaining such hair, you should use a trimmer. Where you actually are not touching the skin, you're not harming the skin, and the hairs does not grow back into the skin. So using a bikini trimmer or any normal trimmer can be used in such areas.
There is a very nice moisturizing razors which are available, and they seem to work wonders because it doesn't hurt. But I don't know about the hair growing back, and I won't know that. But I have been using the moisturizing razors. Is that, I think we should try it as an individual, right?
Yes.
And check which one works for your child.
Yes.
Because we try it on ourselves before we try it on our children, so
Okay.
that we are able to explain to them. Otherwise, sometimes these are areas which are very, very confusing. And that's where I wanted to talk to you, because that is also skin. So yeah, okay. So everybody who has those issues, please contact. Yeah.
Nitin, you would like to unmute and ask?
Sure,
Thank
sure.
you.
So
Thank you for
you.
waiting.
Yeah,
Yeah.
sorry. Yeah, I have also put the question in the chat box. See, my son is
Okay.
7 years old. He has these small bumps on both of his elbows. Now, the pediatric has given the immunosone cream, which seems to work. But then once we stop using it, they reappear. And the discoloration is also happening on both those elbows. And in last 8 days or so, we see that now the bumps are also started appearing on the hands. So we're not sure actually what is it. The doctor just said ignore it or just put a moisturizer lotion, but it looks like it is spreading to the hands as well now. Earlier it was just limited to elbow.
Okay. So
Yeah.
they are skin colored or red colored? Do they itch?
They don't itch. They are not. They are skin colored, not red colored. So I
Okay.
can
Very, very
actually.
tiny. There are very tiny bumps on the elbows.
Yeah, tiny bumps. I can actually show it to you.
Yeah.
1 second. Sorry, I'm taking time.
No.
So like this. I don't know if you can see.
It's difficult to see in the video,
Yeah.
but
Okay.
what it looks is like a lichen striatus.
Okay.
It's kind of an eczematous condition only.
Okay.
Difficult, but it's very difficult to actually point out through the video.
Sure.
But
Yeah.
this could be lichen striatus. So moisturizing and a mild steroid cream base will help with this kind of problem, and eventually it will resolve after a couple of months or a year maybe.
Okay. Sure.
But always good to get it checked with a skin
Yeah.
specialist.
Yeah. Sure. We'll do that.
As I
Actually.
said,
Yeah.
pediatrics sometimes they obviously can't differentiate between such conditions. So, but anyway, it does not seem very nothing very serious.
Yeah.
It
Okay.
should resolve. Yeah.
So another question asks the same thing, that in this humid weather, how to do the skincare for dry skin?
Okay. For dry skin, again, just as I said, some oatmeal or shea butter, ceramide based moisturizer should be used. For groin area, one should use some antibacterial soap. In the market, I can suggest you one antibacterial soap, like it's called Dermadew Backed Soap. It's of H&H company. So you can, for the flexures, for the fold areas, you can use that antibacterial soap. For the rest of the body, use a moisturizing soap only. Continue with moisturizing soap, moisturizers. If your folds get very sweaty, then antibacterial, antifungal powders are available. They're very commonly available at the chemist shop, like Candid or Absorb dusting powder. So on the folds, you can apply those powders, and avoid sending your kids to the park because a lot of mosquito bites, and they itch, and that can cause infections, and those red bumps can occur. So loose clothing, cotton clothing, and full sleeves and full pants your child should wear whenever they go out. So these common things that you can follow.
Yeah. Hope, Dikshita, that answers your question. Next, parents want to know that my son is 4 year plus and has started with a longer hours in the school, and with extremely hot, it's extremely hot, and he develops rashes around the neck and back area.
Okay.
I'm using calamine lotion when it occurs. Is that okay? And also added that also for here, we had been suggested Cetafol. Is there any other better alternative? It's in the chat. I hope I have not read something, pronounced
Okay.
something wrong. Yeah, it's towards the end. Shriveni is asking that.
So basically, probably what she's having, he is having on the back and neck is malaria, which we call alaiya, jaise ho jati hain. So calamine can be safely used for those lesions, and if it gets very sweaty, then you can apply that powder that I was telling you about, that Absorb Candid dusting powder can be used. And Cetaphil moisturizer is good. The other moisturizer that I'd suggested, which is also a cheaper alternative, Aquasoft Max. It's a ceramide based lotion that you can apply. Velucia Max lotion that can be applied instead of Cetaphil if you want to change. And yeah, that's it.
Can you suggest a good suntan, sunblock lotion?
Yeah. So again, depends if your child has an oily skin or a dry skin. So for dry skin, we should generally use a lotion base, not a very gel or matte. Can actually make it even more rough. So one a lotion that I can suggest is Sun Halt Gold Lotion.
Sun Halt Gold Lotion.
Sun Halt. It's from Alchem company. Reasonably priced. It's like around 500. So Sun Halt Gold. So lotion base that can be used. So it's good for
Sammy,
dry
can you
skin.
type that out? And also, is that okay for swimming?
Yeah, the thing is, every sunscreen has to be repeated after 2-3 hours. If you swim, if you go out in the sun, then you have to repeat it again.
Right.
Is sun
Because they
gold
get washed
or
out.
gold? Yeah.
I'm writing it down.
Okay.
Okay.
So another question comes. By the time you type, I'll read it. Like that same parent is asking that spoon-shaped toenails with transverse grooves and flaky nails, and the child has extremely dry skin and nail. Also, I think mucus is there. This is what he wants to write.
So regarding the nail, usually this happens when you have iron and B12 deficiency. So you should get that checked, and try to replace the deficiency if it actually occurs. And other than that, there's nothing much that you can do for the nail. Whenever the deficiency gets supplemented, it will improve.
Yeah. So Arvind, I hope that you got the answer. So another question says that my daughter is 15 years. She has rashes under eyes. What should be done? I think the bumps you were talking about, those, or she's confused. Anusha, if you're there, please unmute and share more about. Yeah.
हेलो।
Yes, Anusha.
यस मैम, मेरी डॉटर के ना अंडर आईज दाने दाने से हो जाते हैं।
स्किन रेड भी हो जाती है, स्किन उतरती है ऐसे ड्राई
नो
होके?
नो नो, नथिंग इज लाइक दिस। ओनली दाने, वाइट वाइट से दाने होते हैं वो।
So the
वो
bumps you were
परमानेंट
showing
है?
of.
परमानेंट है वो या
काफी
आते
दिन
जाते
रह,
हैं?
नहीं आते जाते रहते हैं, परमानेंट नहीं है।
आते जाते रहते हैं और तकलीफ कुछ नहीं देते हैं, खुजली नहीं होता, कुछ नहीं होता?
नो नो नो।
अच्छा, अब जिस तरह के दाने आप बता रहे हो, वो जो मैंने कंडीशन एक बार शेयर की थी, सिरिंगोमा करके होता है, वो हो सकता है। एक मीलिया होता है, उसमें व्हाइट सिस्ट बनते हैं। तो
ओके।
वो यूजुअली तो ऐसे जाते नहीं हैं, बट कभी कभी उनकी अपीयरेंस कम हो जाती है, कभी वो ज्यादा प्रोमिनेंट हो जाते हैं, कभी वो कम प्रोमिनेंट
हाँ
होते हैं,
जी,
वो ऐसे होते हैं।
हाँ जी, हाँ
अगर
जी।
कोई दिक्कत नहीं कर रहा है, इचिंग नहीं हो रही है, स्किन नहीं उतर रही है, लाल नहीं हो रही है, तो एक्जिमा नहीं होगा। तो वो हम एक बार दिखा के ही कंफर्म कर सकते हैं कि उसका एक्चुअली कोई ट्रीटमेंट है भी या नहीं,
ओके मैम।
या उसको बस इग्नोर करना है हमें।
इग्नोर मैम, ये अभी जब देखते हैं ना फिर उसका फेस अच्छा नहीं लगता मेरे को, फिर फेस पे लगता है भी ये क्या हो गया इसके फेस पे।
अगर ये इतना ज्यादा दिख रहा है, इतना प्रोमिनेंट है, तो फिर एक बार स्किन स्पेशलिस्ट को दिखा के कंफर्म कर लीजिए कि वो क्या चीज है।
ओके मैम, थैंक
Skin
यू। ओके
specialist को दिखाना, Anusha.
ओके।
Subhalakshmi ji, you can unmute yourself and ask question. Subhalakshmi ji, you raised hand. You can unmute and ask. No, we can't hear you. You are not unmuted. Yes,
Unmute.
please.
Good evening, madam.
Yes.
Good
My
evening.
son is 43 years old. He has dry skin, dandruff, and very itching on the hairline
Okay.
here. And he scratches so much that red spots appear. After few days, they become black. What
Okay.
shampoo shall I use, and what's the ointment that I can apply?
For the ointment, you can actually use a lotion that will work on the forehead part also, on the scalp also. This one, Candid B lotion.
Candid B.
Candid B lotion. That can be applied on the scalp, and it can applied on the hairline also.
Okay.
And for the shampoo, you can use Scalp Plus. This is available everywhere. Scalp Plus.
SVAL.
I'll write it down here. I think that'll be easier for everybody to see.
Yeah. I think people are asking, getting the correct spelling also. So I hope, doctor, what you're suggesting will be available all over India, because
Yeah, I'm
sometimes
writing very very common and very old products which have been available in the pharmacies since years.
Because sometimes the salt remains same, but the commercial name changes, so that becomes a difficulty for a
But
time.
I think these should be easily available, except for the sunscreen, because sunscreen sometimes not every pharmacy keeps every kind of sunscreen.
Yes,
It comes under thoda, it's a cosmetic thing.
Yes.
So, yeah.
So Abhishek Gupta, you want to ask question? Shubha Lakshmi ji, you have got your answer?
Yeah, madam. For
Yeah.
the black spots, after few days, this red blood-like patches become black.
Black. See, what happens whenever this kind of inflammation, it settles down, it tends to leave some kind of a black hyperpigmentation. जैसे कभी चोट के बाद black निशान रह जाता है. So sometimes whenever such kind of inflammation is going on in the skin, whenever it settles, it tends to leave a blackish mark.
Yeah.
So for the pigmentation, you need to show to a dermatologist, because it's a variety of pigmentation creams are available, and what will actually suit your child, it's difficult to say.
Okay.
So at least for the itching part, you can start with these medicines.
Okay, thank you. Thanks a lot.
Okay, welcome.
So another question says, my son having some white patches in his scalp, and when it's dry, flaky skin is also dry, flaky skin is there.
That also is seborrheic dermatitis. As I said, it's a type of dandruff where but there's extra inflammation. So, severe variant of dandruff. There's a lot of inflammation that happens because of which it becomes red and very itchy. So, Candid B lotion, Candid B cream also come. So that will work for the ear.
Okay.
And moisturizing.
Scalp. It is for the scalp. The parent has asked, patches in his scalp, dry flaky skin. So can we use that?
Candid B lotion can be used for the scalp and the ear both.
Yeah. So then Neha says that my son is having yellowness in feet and hands and also small pimples all over face. So can you suggest something? No?
For the probably that is acne that she's getting on the face. So she can apply clindamycin based gels. I'll write it down here. One of the gels
Yeah.
which is available.
And also, I think washing, you
And
suggested
twice a
twice.
day, yeah, twice a day she or he should wash her face. Now this is the clindamycin gel for acne. This can be applied on the acne twice a day. And for the face wash, again, the face wash has to be seen whether the skin has a dry skin or an oily skin. Because from oily to normal to dry, different kind of face wash are available.
Yeah,
Neha?
Sammy, Neha's baby is, I think, 18 months.
Yeah, she's come unmuted. Neha, you want to add something or ask more?
Yes, ma'am. Actually, I want to show my baby's face, and the small pimples are showing over the body actually. So I was using some products, Himalaya products for soap and shampoos, but right now I stopped everything. I'm just washing his face only with simple water. So I want to show you.
It's a 18-month-old baby, doctor. She's talking about.
No, it's 10 months.
10 months.
Okay.
Yes.
Yeah.
Yeah.
Not actually very visible. Doctor, are you able to make out what it is? नेहा, हाँ, नेहा इस तरह से दिख नहीं पा रहा है स्किन में कुछ क्या प्रॉब्लम है ना? So what would you like to suggest, Dr. Astha, to visit a dermatologist?
You should see a dermatologist. That would be better.
Because she's saying yellowness in feet and hand also. She's saying the child has.
आप एक बार दिखा दीजिए, एक बार स्किन स्पेशलिस्ट को दिखाइए, वो बेटर होगा. आप डायरेक्टली उनके पास जाइए, पहले पीडियाट्रिशियन के पास जाएंगे, फिर पीडियाट्रिशियन रेफर करेंगे या फिर 7 दिन की दवाई लिख देंगे. कई बार काम भी कर जाती है, कभी नहीं कर पाती, तो इवेंचुअली देन फिर आपको वहां जाना पड़ता है. तो
बट अभी के लिए अगर मैम मेरे को कोई सोप वगैरह यूज करना हो तो मैं क्या यूज कर सकती हूँ फेस वगैरह पे लगाने का, बट क्योंकि मैंने सारा कुछ बंद कर दिया है इसका.
बच्चों के लिए माइल्ड जैसे बॉडी वॉश आते हैं, सीटाफिल का बेबी वॉश आता है, आप वो यूज कर सकते हैं. नहीं तो एक टेडी बार सोप आता है बच्चों का, वो यूज कर सकते हैं. वो बिल्कुल माइल्ड होते हैं.
ठीक है.
आप अभी तो फिलहाल वो यूज कर लीजिए, बाकी एग्जैक्ट क्या कंडीशन है वो एक बार देख के पता चलेगी.
ठीक है मैम, आप एक बार राइट डाउन कर दीजिएगा वो प्रोडक्ट प्लीज.
हाँ जी.
थैंक यू.
There is a suggestion from a parent that Derma Dew soap is really good. I'm using it from last 6 years, and it only costs like 400 grams. But yes, it's really good for our children's skin type. I don't know. Doctor will be able to tell more. Derma Dew soap is also recommended by one of the parents. So Abhishek wants to ask.
Derma Dew back soap, ये मैंने उसके लिए एडवाइस किया था, एंटीबैक्टीरियल सोप.
Antibacterial soap. Derma Dew is antibacterial soap. Yes. So Abhishek wanted to ask regarding ear itching. It's the ear of the child which is itching. Abhishek, would you like to unmute? Because doctor might need to know the age of your child and like what many other things. Abhishek, you are there. Please unmute. And also he says that is putting quadridem RF inside ear is okay.
Sorry?
Is putting quadridem RF inside ear is okay?
No. Quadriderm is a very strong steroid, clobetasol steroid that should not be used on anywhere in the body actually without prescription of a doctor. Quadriderm नहीं लगाना है. Forderm, Quadriderm, Panderm, they actually देखा जाए technically they are banned medicines, but वो भी क्योंकि वो सस्ती मिलती हैं वो manufacture हो ही जा रही हैं. तो उसमें क्लोबेटासॉल होता है. क्लोबेटासॉल शुड नॉट बी यूज्ड फॉर अ चाइल्ड. बॉडी में फिर भी चल जाता है बॉडी पार्ट्स के लिए, बट जैसे फेस, नेक, जहाँ पे भी पतली स्किन होती है वहाँ क्लोबेटासॉल शुड नॉट बी यूज्ड. सो कान में नहीं लगाना है. अगर प्रॉब्लम अगर वो कैंडिड भी क्रीम या लोशन से आराम नहीं पड़ रहा है ईयर में, तो आप दिखाइए। उससे भी थोड़ी सी मॉडरेट लेवल की क्रीम्स होती हैं विच आर सूटेबल फॉर द स्किन, दैट कैन बी यूज्ड। अदरवाइज अगर कुछ हल्का फ्लेकीनेस रेडनेस है तो कैंडिड भी क्रीम से सबसाइड हो जाएगा। बट कॉर्टिडम नहीं करना है, डिपेंडेंसी आ जाती है फिर कई बार कि जब तक आप स्ट्रॉन्ग स्टेरॉइड ना लगाओ तब तक रिलीफ ही नहीं मिलता है।
Or inside ear is, I think, is more.
हाँ हाँ बिल्कुल नहीं।
Abhishek, you need to see a dermatologist as soon as you can for your child. Nishita's mom, or is it Nishita? Please unmute.
Yeah. I just wanted to ask you, actually, my daughter, she has, those red spots with the white mouth on her bumps, and on the folds, it is very dark, like pigmentation. I apply Candiderma cream and I apply antifungal powder also. It removes the itching, but that thing doesn't go away.
The pigmentation.
Pigmentation, even the red spots with the white mouth doesn't go away. They subside a little bit, but they don't go away applying these two things also.
Okay.
It's been a regular routine now that every day I have to do it around her bumps and around her pubic area.
Uh-huh. So probably what you're saying is keratosis pilaris. If it is not paining, if there's no inflammation, then most probably it is keratosis pilaris. Those keratin white plugs with the red halo might be present around the hair follicle. So basically you can use some, as I said, urea-based, lactic acid-based moisturizer to smoothen it, but it won't entirely go away.
That is the whole problem. And why doesn't it go away?
Because that keratin plug will redevelop.
Okay.
And it is a natural tendency for the skin to develop those keratin plugs again and again. And it is normal for us also. It can happen to anyone, to us also. The outer surface of arms, thighs, buttocks, all these frictional areas develop these kind of keratin deposits.
Okay. So this is any particular cream that I should use that you're saying?
You can use Zerina cream. It's a very multi-purpose cream. It has glycolic, urea lactic acid. So Zerina, Xerina. That will help to smoothen the skin.
Actually, she has a very dry skin.
It'll act as a moisturizer also.
Okay, it'll act as, because, and after generally if she gets her vaccine done, so the things you're saying it on arms, it appears on the arm and then she feels really itchy and it's like a, a kante wali feeling.
Yes, I totally understand.
So it then I should apply once in a day or how many times?
Start once a day.
Once a day should start. And any other, I know it is not going away. So by using this cream,
it will reduce. It will not completely go away.
Okay.
For it, we can actually minimize it for our patients. Sometimes we suggest chemical peels or some other stronger medicines. But for your child, I would suggest start with Zerina cream. It will smoothen a little, and just ignore.
Okay, just ignore and constantly use this powder and the Candiderma.
On the folds can be used. Candiderma you're using?
Candiderma plus cream. Actually, this was recommended by my doctor.
I'm not sure what it contains.
Okay.
Candiderma. I hope it's not clobetasol.
Plus cream. And then I'm using T-Bact also because if those, मतलब वो ज़्यादा बढ़ जाते हैं and it starts to pain, I put T-Bact so it subsides.
Okay, see, probably then it is turning into folliculitis. So for that you can apply T-Bact cream.
That too I apply. When it gets a little, mota and it starts to pain, then I apply that. So usse to that subsides, but the only thing is it subsides only, but it doesn't go away. So I use that.
Probably you can show to your dermatologist and get it confirmed whether it is folliculitis, whether it is keratosis pilaris.
Okay.
You can get it confirmed once.
Okay.
And daily care will be required for that. So
I
parents.
do scrubbing also. Scrubbing is okay at once a week.
For keratosis pilaris, yes.
Yes, because once a week I do the scrubbing because then I think so. Somebody told me to. My doctor only told me to scrub so that the excess
can be done.
Okay.
Once a week scrubbing can be done.
Yeah.
Okay.
So it is Zerina cream. The
Yeah.
spelling has been put in the chat box because few are asking for spelling, how to spell.
It is right,
And
Serena.
this can be used for boys and girls. I don't think so. Okay,
Can
skin
be used
has
for
any
both boys
problem.
and girls,
Yeah,
yes.
yeah. So Dikshita, can be used. And Neha
हमारे पास
wanted to ask
सिर्फ
कि any
5
lotion.
मिनट बचे हैं
Exactly.
तो
My
हम अभी
clock shows that
कहते
we
हैं
have
कि जल्दी से
covered.
हैंड रेज करके जो भी सवाल है आप अपने पूछ लीजिएगा
Yes,
हैंड रेज
and
कर सकते हैं आप एंड सवाल अपने पूछ लीजिएगा
yes, and along with that also, we really want to thank Dr. Astha for in such a short notice and so patiently you have been, you know, actually giving answers to our parents, and it is very, very important for us to have a, you know, a person in your expertise area with us. So we will be contacting you soon for like how to actually loop you for our, you know, regular sessions or thing.
Sammy,
And
one question I want to ask.
yes, Brenda, please ask.
Ma'am, this is for Dr. Astha. Ma'am, I just want to know if parents want to connect with you. I mean, because right now I'm sure many of them would still have questions which they
Yes.
haven't been able to ask. Is there any way, I mean, through mail or whatever, where they can connect with you and you could respond?
Yeah.
I mean, if it's not too much of a hassle, I just.
Yeah.
Yeah.
Otherwise, in Delhi NCR, ma'am is always present there. She sits in two of the different hospitals, which is mentioned in our flyer also. So you can check with the hospital, her timing and her availability, and book an appointment and directly go. Those who are outside, Dr. Astha, we would like to know if you can give them any, you know, contact, if they can reach out to you.
So
and
I'll give you my my clinic
ID would help.
contact number.
Yes. Like COVID has given us a lot of options of, you know,
Online consultation,
virtual
exactly. So this
consultations.
is my clinic, this number that I mentioned is my clinic number.
Okay. So parents, eyes down to chat box. Please note down the number. And Brinda, you can also float otherwise later.
You know, Astha, if you have other young dermatologists who can support the cause in various places and, you know, talk to them, if like places like Bombay, Delhi and the main cities, if you have somebody who you can mention, because see, one thing I know about skin is that it's a long-term plan. And you just have to keep going back again and again. And the dermatologist should have a lot of patience. Sometimes our parents also get overpowering and not realizing that this is not going to get cleared up in one day. So skin is definitely one of our biggest issues, and the treatment itself goes on, I think, for a long time. And parents give up very quickly. So if you have people in various parts of the country who you might have worked with or studied, and you can mention and give us a list, we'd be very grateful for that.
I will do that. I can share the details with Mrs.
We'll get in touch. Rashmi or
Samiksha.
Samiksha. Dr. Astha, we'll get in touch.
Thank you so much. Thank you. Honestly, that will be such a big boon because, you know, go and show, because skin is one thing you can't ask questions. You have to show it.
You have to show, exactly. The proper examination.
And just referring a cream online might not be the answer. But honestly, you are young and dynamic, and we are very, very impressed by your work. Thank you so much.
Thank you again for your lovely words. It is a pleasure being part of this evening.
बिल्कुल डॉक्टर, हमें भी बहुत अच्छा लगा। एक तो सबसे अच्छी बात ये है कि मुझे और समीक्षा को बहुत ही खुशी होती है जब कोई इतना कॉम्पैक्ट वे में अपना प्रेजेंटेशन लेके आते हैं, और जिस तरीके से आपने सवालों के जवाब दिए हैं एक के बाद एक, और बहुत इतने सारे पेरेंट्स को, मुझे लगता है बहुत कम हमारे सेशन इस तरह से हो पाते हैं, तो उसके लिए बहुत खुशी है हमें आपको हमारे साथ पाके, और आगे भी आपके साथ हम काम करना चाहेंगे। तो डॉक्टर आस्था को हमसे मिलाने के लिए आईपी का और डीएसपीएस का धन्यवाद, डाउन सिंड्रोम फेडरेशन ऑफ इंडिया से। और हम अपने अगले सेशन में आपसे फिर मिलेंगे शनिवार को। जाने से पहले वृंदा जी, कलकत्ता के बारे में हमें कुछ अपडेट्स आप करेंगे तो अच्छा लगेगा। थैंक यू वेरी मच।
Thank you so much, Parul. Guys, Calcutta, we are almost full. We just have 2 rooms left. No kidding, just 2 rooms left. So those who are interested, please register. I have shared the link multiple times, and I will share it again. So request you all to register at the earliest. Just 2 rooms left, and then please don't come to us later and say,
Madam, one
Adjust.
room, is very difficult for us to accommodate. While we would love to accommodate all of you, and Rekha ma'am always scolds me for saying no, but when there is no room, I really can't build rooms, neither can Rekha ma'am. So please register at the earliest. And there's a lot happening. The team is going to Calcutta to again, kind of see what more can be done for you guys. The self-advocate session is going to be an eye-opener for all of you, and I can guarantee you that all of you will enjoy it, especially the self-advocates. At least for their sake, you all must come to Calcutta and experience IIDSE once again. So we look forward to having all of you with us, especially Rekha ma'am. I'm sure she's so keen. She keeps thinking of new things every day. We are trying to see how much we can fit into 2 days. Very difficult, but there is a lot that can happen just with your support. So register at the earliest. We'll be sharing the link again by Monday. And those who have not registered, please do. Those who have, do keep us informed also if you've made the next payments, because most of the time, if you forget, it's difficult for us to track. So thank you, everyone. And we look forward to having all of you next week again.
Yes. Thank you so much, Dr. Astha, once again for
Thank you,
coming.
thank you.
Yeah. And all the best to you. And thank you, parents. Thank you, Brinda. Thank you, Ma. Thank you, Parul.
Thank you, Sammy. Thank you, Parul. And thank you all for bringing in such an amazing expert. Thank you so much. God
Okay.
bless
Thank you, Dr. Astha. It was a
Thank
pleasure
you,
having
thank
you
you,
with
thank
us.
you.
We'll trouble you
Yes,
again.
my pleasure is
And
mine.
I'm sure the Delhi team will definitely trouble you again regarding the contacts for all the others.
Sure.
Thank you. Thank you,
Thank
everyone.
you.
Okay,
And
okay.
thank you,
Thank you,
Dr.
Rashmi.
Astha.
Bye, please.
I'm
Most
ending
welcome.
this